Hello, my name is Laura Kulik. I am a transplant hepatologist at Northwestern. It is a pleasure to present our results of a pilot randomized controlled trial looking at the safety and efficacy of radioembolization with sorafenib compared to radioembolization alone in patients who are awaiting transplant. This was a total of 20 patients, and of these patients, 17 underwent transplantation. Between the two groups, there was no difference on explant pathology or radiographic response. Also, overall survival at 3 years was similar at approximately 70%. A surprising finding was that we did find an increased rate of peri-transplant complications among those patients who were randomized to combination therapy, with increased rejection rates as well as acute biliary complications. In summary, this study did not show an apparent benefit of adding sorafenib to radioembolization compared to radioembolization alone in patients awaiting transplantation. First of all, this is the first randomized controlled trial looking at radioembolization plus sorafenib compared to radioembolization alone in the setting of transplant. And our study showed no benefit in terms of overall survival, explant analysis compared to in the two groups. Compared to chemoembolization and sorafenib, there is limited data, and that data is limited to retrospective analysis. One study similar to ours also showed an increased perioperative complication rate of biliary complications as well as increased acute cellular rejection. On the other hand, another retrospective analysis did not find any increased perioperative complications. In light of recent changes to UNO, specifically SHARE 35, I believe patients with HCC will be waiting a longer period of time. Given that, I would modify our protocol to not stop the sorafenib after 1 year of total duration and would continue that longer. That itself may have a increase in efficacy of the sorafenib. In terms of combining sorafenib with radioembolization, I think the data is not quite yet readily available to make a comment that this should or should not be used. However, I must say it must be done in a cautionary fashion given not only our findings but also the findings from Truesdale and colleagues.